Hi everybody, myself Dr. Ashwath Kumar, Senior Consultant, Internal Medicine, Diabetes and Blood Pressure at Kaveri Super Speciality Hospital, Electronic City. Friends, just today we want to have a brief introduction about blood pressure and its management and how to prevent it and what exactly is the blood pressure. So in the next few minutes, we will have awareness about the blood pressure and its management. So basically in the common man's mind, what is blood pressure and why the blood pressure is important in day-to-day life and how to manage it and prevent long-term complication. And as all of us know that blood pressure, like diabetes, is one of the commonest lifestyle diseases affecting the mankind all over the world. So, and an uncontrolled blood pressure leads to so many end organ complications, and it is easily a preventable disease. By preventing it, we are preventing so many complications uh, and its implications on the body. So normally blood pressure means when the heart beats, the tension or the resistance created along the blood vessels uh, is nothing but a normal blood pressure. So everybody, uh, the blood pressure generally normally varies from time to time and hour to hour and day to day. But generally, all of us healthy persons will be able to keep the blood pressure at a normal reading of 120 by 80 millimeters of mercury. But a sustained increase in the blood pressure more than this reading for a lengthy period of time is what we call it as a blood pressure, high blood pressure. So, in a day to day life, the blood pressure, which is more than 140 by 90 millimeters, 140 is systolic, 90 is diastolic, we label them as having a blood pressure. So this needs to be controlled. So why exactly a person, he or she develops a blood pressure? The exact reason is not known, but plenty of factors might contribute to the development of this blood pressure. So one is increased salt intake, lack of physical activity, family history of something like connected to genetics, some members in the family having a high blood pressure, and there is every possibility that the offsprings also will have a 50 to 60% chances of having high blood pressure. And advancing age itself is a strong predictor of risk factor for developing blood pressure. Suppose many people aged about 70 or 80, 70 to 80% will have high blood pressure. So as the age advances, the vessels will undergo stiff, and there is a very possibility that he or she can develop blood pressure. And also the finally, but not but the least, is the stress. The exact amount of stress what we undergo on a day-to-day life causes lot of variations in the blood pressure in the office hours or during the stressful period, and chronic uncontrolled stress on a long time leads to very high blood pressure. So all of these are one of some of the risk factors for development of the blood pressure. So in blood pressure we got two varieties. One is systolic, another is diastolic. So systolic is nothing but what the top one, what we call it as. So somebody 120 by 80, 120 is top one, 80 is diastolic, the down one. So 120 is systolic. So each time when the heart beats, the amount of resistance what is created, that is what we call it as a systolic blood pressure. So when the after the beating finishes, the ventricle undergoes a relaxation phase, that is called as diastolic blood pressure. So increase in any of these blood pressures, both are equally important, and sustained increase in both systolic and diastolic blood pressure leads to so many end organ complication, and many of these things are easily preventable. So uh, uh, in general, the persistent increased blood pressure generally needs treatment, and the treating physician will be able to advocate the right sort of a treatment for the particular patient. So as we know that there are crores and crores of people have been diagnosed with hypertension globally, more so in Asian countries like India, there is a very high incidence of diabetes and blood pressure. Both can go hand in hand, or one may follow another one. So once we diagnosed with having the blood pressure, what sort of a lifestyle interventions and medications are required? So as I already told you, the main lifestyle interventions once we are diagnosed with blood pressure is a healthy lifestyle, like regular exercise, physical activity. For example, the more we exercise, the more the blood pressure will be under control. One. So because exercise increases the blood pressure, depending upon the amount of exercises what we do. The vigorous the exercises, the higher the blood pressure. But the blood pressure, whatever it rises after exercise, is a temporary phenomenon. So naturally, most of the blood pressure, whatever it rises after exercise, is going to come down within a period of few minutes, and that itself will increase the will control the blood pressure. So that means it is something like a endurance testing. The more exercises you do, more chances of getting blood pressure under control by means of a good aerobic physical activity. So what is this aerobic physical activity? Any activity which increases the heart rate in the form of swimming, cycling, jogging, they are all beneficial in a long way in controlling the blood pressure. Second, low salt diet. Low salt diet is avoid an extra salt. Don't take any extra salt. Even the dietary day-to-day salt, whatever we use it for cooking at home, needs to be reduced. Approximately the WHO recommend 3 grams of salt in 24 hours is more than sufficient. So avoid putting extra salts. In general, a layman word I can say, stop putting extra salt to salads like cucumber, or putting extra salt to the curd rice, or putting extra salt to the, or eating a salty snacks in the evening or in the leisure period in the form of groundnuts, haldirams or something like that, etc. These things should be avoided, including the eating of the processed foods like junk foods, everything. This is the one thing. So third and the most important thing we need to follow will be the medications advised by the doctor. There are plenty of advanced medications right now available in the market to treat blood pressure, and which are the medications suitable for each and every patient, depending upon the category of the patient, doctor is the right person to choose the medication. And the compliance with the medicine is the utmost important thing in managing the hypertension, because non-compliance to medicine, or a doctor prescribes the medicine, patient takes it for a few weeks or a few months and stop the medicine. This is not going to get the complications under control at any time. So we need to keep it in mind that whatever the medications the doctor prescribes for the patient will be for lifelong. There is no shortcut in controlling diseases like diabetes or high blood pressure. That means whatever the drugs they prescribed by the doctor need to be taken on a long term, and the compliance in a day-to-day life is very, very important. And frequent follow-ups and frequent recording of the blood pressure in consultation with the doctor is required for achieving a long-term blood pressure goal. So follow the advice of the doctor and be compliant with your medicine, achieve a healthy lifestyle, follow some dietary intervention, will go a long way in controlling the blood pressure. These are the two things. And whenever a person is diagnosed with blood pressure, there is a high possibility that the same patients might have a high sugar or a high cholesterol, which go hand in hand. So that once a person is diagnosed with blood pressure, there are some baseline tests which doctors will advocate, like cholesterol or a lipid profile, blood sugar, kidney functions, or a routine checkup of the eyes, because uncontrolled diabetes or hypertension can lead to a lot of damages in the eyes, kidneys, and enlargement of the heart. So whenever a person is diagnosed with blood pressure, a baseline tests are indicated and the doctor will advise those tests, and depending upon that, any additional treatment is required. Like I already told you, a person who is having high blood pressure may have a high sugar. A person who is having high blood pressure might have a high cholesterol, like high bad cholesterol, what we call it as LDL. So we need to not only treat the blood pressure, we need a treatment for blood sugar, we need a treatment for the high cholesterol. And another interesting thing we need to learn is that 30% of the patients with hypertension will have increased uric acid. Exact reason why this uric acid is increased in hypertension, not known. But invariably, when the uric acid is also increased, doctors will prescribe a treatment to reduce the high uric acid, which also untreated uric acid also will have impact on cardiovascular system, joints, and it can lead to diseases like gout, etc. So these are the things. So friends, at the outset, I want to conclude by saying few silent points. Hypertension is one of the leading killer in the world, which is causing lot of preventable diseases like stroke, heart attack, heart failure, diabetes, hypertensive retinopathy, etc. Most of the complications of hypertension are easily preventable by taking the right advice of the doctor and following a healthy lifestyle and taking the medicines as advised by doctor for a lifelong period and achieving a healthy lifestyle will go a long way in achieving a long-term blood pressure control and avoiding long-term complications like kidney, heart, stroke, eyes, etc. Uh, that is the ultimate message what I want to convey to the public. And so at the outset, I'll say one word: health is wealth. Keep your health first, and then the wealth follows. And always stick to the advice of the doctor. Never neglect any diseases. Have frequent health checkups and have frequent BP checks at home. And if there are any symptoms pertaining to blood pressure like headache or a dizziness or a variable blood pressure in the office, please consult the doctor and take the right advice. And all these things will go a long way in achieving a long-term blood pressure control. Thank you.